Parkinson's disease treatment in Turkey. This serious but quite common age-related illness makes life very uncomfortable. However, symptoms of Parkinson's disease can be eased with deep brain stimulation. Today we will discuss this method and its effectiveness, and we'll meet a neurosurgeon who performs DBS treatment for patients with Parkinson's in Antalya, Turkey, including for foreigners. Subscribe to the channel and ask questions in the comments. We're talking about medicine in Turkey. Parkinson's is a neurological disease that progresses in time. Among symptoms of Parkinson's, we can name tremors, rigidity, slow movements, and gait problems. Parkinson's disease primarily occurs due to a reduction in brain cells that produce dopamine, which are referred to as the substantia nigra. With age, these symptoms become more pronounced. There are several ways to alleviate Parkinson's symptoms, and neurostimulators are considered the most effective option. Healthy Turkiye company connects patients with top specialists for this issue. The basal ganglia or substantia nigra sometimes causes abnormal, uncontrolled hyperactivity of neurons. Deep brain stimulation suppresses these excessive impulses and thus prevents abnormal muscle movements, uncontrolled contractions, and tremors. Professor Tanju Uçar, a neurosurgeon and expert in neuromodulation. Graduated from Cerrahpaşa University in Istanbul, he studied at the Neurosurgery department of Emory University in USA and completed his specialization at Akdeniz University. Since 2000, he has been involved in research and teaching here, serving as a professor for over 12 years. A member of various professional neurological associations, often appears as a guest expert in the media. Could you explain us the technology and surgery procedure in detail, please? Parkinson's was the first disease in the world to be treated using a technique known as deep brain stimulation. And it is the most often performed surgery of this kind. DBS is very effective. I have already explained the logic of DBS treatment for Parkinson's disease. In simpler terms, it is a surgery that curbs heightened activity. DBS, or deep brain stimulation, is a surgical procedure where electrodes are implanted in specific regions of the brain. The surgery aims to alleviate symptoms by stimulating these targeted areas. These electrodes enable high-frequency impulses to traverse, affecting neural pathways and modulating specific motor signals from the brain, regulating their activity. We place electrodes in the area of the brain that we believe causes Parkinson's disease. This area is roughly 6 millimeters, or maybe as small as 4 millimeters. These electrodes control or modulate the function of this area. The modulation process is monitored by us. This is how the system operates. How effective do you think this method is? What can a person with Parkinson's disease expect when seeking your help? To answer this question, we must bear in mind that Parkinson's disease is a progressive condition. So, the procedure we perform does not eliminate Parkinson's disease completely. DBS regulates the manifestation of Parkinson's disease and alleviates its symptoms. Therefore, when a patient undergoes brain stimulation surgery, they cannot say things like, "I am free from Parkinson's." A patient with Parkinson's may feel slightly better this year, but next year the situation may worsen and progress. Therefore, the expectations of the patient and the doctors regarding treatment must take this into account. Doctor, what makes this method better than other treatment options? When we talk specifically about Parkinson's disease, other methods include first, medication treatment, and the second method is surgical intervention. The medication method has side effects, some of which can be quite serious for the patient. As Parkinson's disease progresses each year, so medication doses need to be increased. For instance, assuming a patient's currently on 4 medications, they'll require 6 different types of medications the following year. In the years to come, this number will experience further growth, and then it becomes unbearable for the patient. This is where the advantages of DBS treatment become clear. It significantly reduces the number of medications needed and their side effects. This is the main benefit of this method. How long does this system work, and when must the stimulator be replaced? There are two types of neurostimulators available for Parkinson's. The first type is a constant action stimulator, while the second one has a recharging feature. The average lifespan of constant action stimulators, which cannot be recharged, typically lasts between 4 and 6 years. We continually monitor the battery's status and check its power using a computer system on a regular basis. When power diminishes, we notify the patient that a replacement is needed. Then, with a simple surgical procedure, we remove the battery and install a new one. It's that easy. The second stimulator type has a recharge feature. This system has both benefits and drawbacks. The benefit is that this system is long-lasting, potentially working for around 15 years. However, this system needs to be charged once a week or every 10 days. So, how to charge it? The battery is placed on the chest. We take a charger and charge the battery for 1 to 2 hours. That can be seen as both an advantage and a disadvantage. Dementia patients may struggle with this. Also, elderly patients often cannot do it. So, in such cases, we prefer a different system. Good neurosurgeons can explain their actions in very clear terms, making their work seem easy and straightforward. However, their field is among the most complex in medicine. Maybe that is why it's hard to reach neurosurgeons' help in many countries. We have a whole playlist on Turkish neurosurgeons' types of assistance at this link on the screen. The Turkish healthcare system's peculiarities simplifies access to high-tech services. But that's also the reason why you need to choose a doctor here more carefully. Healthy Turkiye, a specialized service company, has deep market knowledge and understands the differences between clinics and specialists. It organizes medical trips to Turkey for foreigners and assists them during their treatment. The work is overseen by coordinating doctors who are specialized staff with medical diplomas and work experience in Turkish hospitals.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkiye, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home. We also talk a lot about our work on our Instagram account. You can subscribe to our Instagram via the link or QR code to get to know us better and, of course, to understand how our company works in general.
How often is the method of brain neurostimulation used in treating Parkinson's disease? Parkinson's disease has 3 primary symptoms. The first one is the slowness of movement, known as bradykinesia in medical language. The second symptom can appear as tremors, meaning shaking in the hands and other parts, which are uncontrolled small oscillations. Muscle rigidity is the third symptom. Parkinson's disease can also lead to mental issues, showing psychosymptoms similar to dementia. Spinal problems are another symptom that accompanies patients with Parkinson's disease. So, in what cases can we perform surgery? Firstly, it should be a genuine case of Parkinson's disease, since there are diseases that mimic it. We refer to this as Parkinsonism, or Parkinson's plus disease, which is a condition that mimics Parkinson's disease, but these are separate issues. So, the first main condition is that the patient definitely has true Parkinson's disease. The second factor is age. It's important for brain stimulation surgeries. The average age limit typically ranges from 72 to 73, give or take a few years. We're trying to avoid this procedure after 75 for several reasons. With age, dopamine levels in the brain drop, which may cause the system to fail. So, the age is the second factor. The third important question is that we need to know the reaction to the Parkinson's medications used. The patient's body must respond to the medications taken so that it can also react to the DBS system impulses. This is the third important matter. The fourth, very important condition is that there should be no serious psychiatric issues, such as severe depression, schizophrenia, or similar problems. If the patient meets the requirements I've stated, we can carry out the operation. Turkey offers a unique, comprehensive approach to patient care. In other countries, each procedure often incurs a separate fee. Healthy Turkey Company manages the organization of these trips based on all-inclusive principle, working exclusively with trusted specialists in both medicine and in the hospitality sector, coordinating all their work for each patient. Healthy Turkey handles everything, from consultations and arrangements with the clinic and doctor to transfers, lodging, migration formalities, and translating medical records. You can see the company's website address on your screen. This website allows you to consult and find information about other quality medical services in Turkey. Week by week, we are talking about treating various diseases and serving medical tourists in this country. Subscribe to our channel and stay updated with new videos. We would love your likes as well.